Hey everyone, so today we're going to talk about some allergy drugs. So a lot of you might have allergies, a lot of you might have experience with these drugs. So today we're just going to clarify exactly what makes those drugs work. So let's start off with the basics. What is an allergy? Well, an allergy occurs when the immune system reacts to a foreign substance, otherwise known as an allergen. So these foreign substances are something that the body recognizes as something that's not already within the body. It sees it as a foreign invader, and because of that, it reacts to the presence of that allergen. So the body's immune system, through this reaction, creates antibodies to fight and eliminate harmful substances. So these allergens, or I shouldn't say allergens, but these harmful substances ordinarily that the immune system reacts to are bacteria, viruses, or environmental irritants. Smoke, for instance, smog, chemicals that you might be breathing in the environment that might cause inflammation that stimulates the immune system to start working. But however, sometimes the immune system makes antibodies that identify a particular allergen as harmful, even though it really isn't. So a great example of this are pollen allergies. Pollen really doesn't do anything to your body. It's not a toxic substance or anything, but many people have an allergy to pollen, myself included, where our body treats that pollen as a foreign invader that's getting into our lungs, getting into our airways, and due to that, it causes inflammation and an allergic response. So these could include pollen, they can include food allergies. I'm sure many people have heard of peanut allergies, seafood allergies, things like that. Dust and dander as well is very common, and medication allergies, of course, are something that we always look out for within the pharmacy. Now, in severe allergic reactions, a person may experience something called anaphylaxis. Anaphylaxis is just an extreme immune response that may close the airway, and it can be potentially lethal. Now, allergy symptoms, of course, are not always as extreme as anaphylaxis, although anaphylaxis is something we always must look out for. However, most of our allergy symptoms are what you would think: sneezing, itching of the nose, watery eyes, the roof of the mouth, watery, red, or swollen eyes like conjunctivitis. That's very common with pollen allergies and other environmental air allergies. We also have hives as a possibility. That's especially common with drug allergies and food allergies. Insect stings, of course, swell up, and that's part of the allergic reaction and the allergic immune response. And of course, depending on the severity of the allergy, it could be a minor allergy or all the way to anaphylaxis. Now, anaphylaxis, again, is a life-threatening allergic reaction, which causes the body to go into shock. So when the body goes into shock, we have a number of symptoms. This could include a loss of consciousness, a severe drop in blood pressure, so a person may faint, severe shortness of breath, and especially the closing of the airways, which is characteristic of a severe anaphylactic reaction, where the airway swells up so much in response to this allergic allergen stimuli that the body simply cannot breathe, it can't take in oxygen, and it can potentially be lethal. Skin rash is also a side effect of, or a symptom rather, of anaphylaxis, in addition to lightheadedness and a rapid or weak pulse. So, of course, the first thing we do if someone is encountering anaphylaxis is to call 911 immediately, inform emergency services, make sure someone is on the way to be able to treat this and handle it as a medical professional. But what we do, especially if someone knows that they have a very, very severe allergy to something, is they might be carrying around an EpiPen because we want to administer epinephrine. Now, epinephrine, otherwise known as or dispensed within an EpiPen, it works by binding and relaxing the muscles of the airway and lungs to prevent the airway closure. So that airway closure, that constriction that happens when the body's like, oop, oop, I don't want any of this foreign invader to come into my body. This is the reaction. We want to close everything off. The epinephrine constricts blood vessels to combat shock, as well as opens and relaxes the muscles to stop that shock and to stop that allergic reaction and inflammation from completely cutting off the airway. And it keeps these people alive until they can get help from emergency services. Now, the EpiPen is a subcutaneous injection, meaning it goes into the fat muscles or the fat within the leg. You can see it right there. It's administered right there with the there's usually an EpiPen 2-pack, so that's an auto injector. You stick it into the leg right there. You wait for that click. It clicks, and then it starts. There's a tiny needle inside it, and it administers that epinephrine subcutaneously right into the leg, right into the body. So it's just about instantaneous in terms of its effect. By doing so, you do it, of course, immediately upon exposure to the allergen or the beginning of anaphylaxis. Hold it for 10 seconds. You can also inject the other pin as well if the allergic reaction doesn't improve, to at least bide you time until those emergency services can arrive. Now, this is, like I said, it's only a temporary solution until the person visits an emergency room, and then they can be treated more aggressively with other drugs that don't need to be self-administered. Now, for allergic reactions that are not as severe, we have antihistamines. So antihistamines combat histamine. Well, what is histamine? It's simply a chemical released by white blood cells. So those are the blood cells that are responsible for your immune response, your immune system, in response to potential allergens. So the release of histamine triggers the inflammation that is characteristic of allergic reactions. So this guy right here, he gets this flush reaction when he is exposed to an allergen. So histamine has been released in his body, which has caused this flushing, this redness of the skin. Likewise, the histamine triggers inflammation in response to, I believe these are bug bites. So this person was bitten maybe by some fleas or something like that, or mosquitoes, and that inflammation is that histamine release directly in response to that foreign allergen entering into the body. Now, antihistamines antagonize or block histamine from reaching the histamine receptors in the body, which reduces the allergic responses. So when histamine binds onto these histamine receptors, that's what causes the inflammation. By introducing an antihistamine, those antihistamines bind onto those same receptors, so the histamine can't bind onto it. What does that do? Well, the antihistamines don't trigger the inflammatory response, so they stop that histamine from reacting with the body and creating that inflammation. Thus, we have our antihistamines. Now, these examples of antihistamines, you've probably heard of them all. They're all over-the-counter products. We've got our diphenhydramine or Benadryl, cetirizine, Zyrtec, fexofenadine, better known as Allegra, and loratadine, much better known as Claritin. Now, diphenhydramine or Benadryl, probably one of the most well-known antihistamines. And like we said, it reduces the effect of histamine on the capillaries, specifically the small blood vessels in the skin, and that reduces an allergic reaction symptoms like swelling and itching. So diphenhydramine is very, very often used for bug bites or allergic rashes or hives. It's most notable that it comes in a cream formulation, but it also has an oral formulation as well. Now, you do not want to use those oral and topical formulations together at the same time, because that could lead to some more side effects, possibility of overdose even, and an additive effect, which we do not need. So you pick one or the other if you're going to use Benadryl to combat an allergic reaction. Now, the main side effect to remember about Benadryl is that it causes drowsiness. Now, this is not as common with the topical forms of Benadryl. So if you're using the Benadryl for a bug bite or something, and you're just rubbing it into the skin, as for the anti-itch cream, that antihistamine cream, generally you're not going to get tired or have many systemic side effects at all. However, if you take it as a capsule or a tablet, depending on which dosage form you have of it, it does cause, it's fairly commonly used to cause drowsiness. Sometimes people even take Benadryl as a sleep aid. They shouldn't be doing that, but it is something that's sometimes used in order to make a person fall asleep, because it's that fatigue inducing. Now, Benadryl also has a chance for photosensitivity, and you want to make sure to avoid using it on any sort of open wounds, especially when you're using it topically. Our other antihistamines include cetirizine or Zyrtec, and that's available in tablets, chewables, syrup solution, or even injectables. So you may see Zyrtec or cetirizine even used in a hospital setting as an IV drug. We also have Allegra, which is just tablets. It's most known, you do have to take it with plenty of water, more so than some of these other antihistamines. And then we have Claritin, which of course, live Claritin clear, right? That's the commercial. Tablets, orally dissolving tablets or ready tabs are quite popular, especially with kids. So they just dissolve right on your tongue as you put them in there. And drowsiness is also a potential side effect of these other antihistamines, but it's not as much as Benadryl. These drugs are newer, so the way that they were developed, they made sure to try and minimize that drowsiness side effect. So it is a bit nicer. And as you can see, many of them are advertised as non-drowsy, such as Claritin. However, these antihistamines also have some other effects, most notably dry mouth. They can also be sedating, again, with other sedating medications. So for instance, if you're taking it along with a benzodiazepine, with an opiate medication, with other medications which are known to cause drowsiness, it might cause an additive effect and make you more sleepy than normal. But I would say these are generally well-tolerated drugs and they're very, very safe, which is why they're available over the counter. Now, that is just about it for allergies. As always, if you have any questions, feel free to contact me. Thanks.